Hi, my name is Sandy Curtin, and I'm going to be talking to you today about managing the side effects of treatment associated with MDS. There are 3 currently available FDA-approved agents for the treatment of MDS. Those include azacitidine, lenalidomide, and decitabine. Each of these are given in a slightly different way, and each of these are associated with individual side effects. The most common side effects that we see with treatment for MDS include myelosuppression. This may also be disease-related in the earlier phases of treatment. This includes anemia, neutropenia, or thrombocytopenia, otherwise known as cytopenias. There are other resources in the Building Blocks of Hope project that cover this information. Other common side effects for most agents include nausea and vomiting, constipation, and renal and hepatic toxicities. This is associated with your kidneys or liver. Then there are certain drug-specific adverse events that include those associated with azacitidine, which is the only drug that is given as an injection under the skin. And with lenalidomide, you may see a rash, itching or pruritus, diarrhea, and this drug specifically requires a safety program. Let's talk a little bit about some of the things you can do to manage these side effects. For nausea and vomiting, we suggest that you avoid exposure to strong odors, including perfumes. We also suggest that you discuss with your providers antiemetic medications or anti-nausea medicines that you are able to use, and how many of these and what dose you can use safely. Some of these medications can also cause constipation, so you'll need to talk more about that with your providers. Make a note of any symptoms of nausea that you have or episodes of vomiting. If you experience more than 5 or 6 episodes a day, you need to contact your provider immediately. Also, if you notice any blood when you vomit or are not able to keep food or liquids down, be sure to contact your healthcare provider immediately. Additionally, talk with your healthcare provider about when and how to call in case of more severe symptoms. We suggest that you drink 2 to 3 liters of fluid a day. Avoid caffeine or high sugar drinks. Eat small, frequent meals. Some foods you might want to avoid are fatty foods, greasy foods, spicy foods, foods that are hard to digest, such as hard fruits, meats, hard cheese, or popcorn, alcohol, caffeine, and chocolate, and foods with strong odors. Increase the intake of foods and fluids high in sodium and potassium. These are electrolytes that you frequently lose when you have nausea and vomiting. These include things like broths, soups, and low-sugar sports drinks. Brush your teeth more frequently and use non-alcohol-based mouthwashes to reduce the symptoms of dry mouth and bad taste. Peppermint and ginger supplements have been found to be helpful for some patients. Relaxation, imagery, and meditation may help you as well. Ask your healthcare team about any additional resources available and ask for help from family and friends. Let's now talk about constipation. Things you can do to avoid or treat constipation include maintaining a daily exercise program. Even walking can improve bowel motility. Stay hydrated. Again, drinking 2 to 3 liters of fluid per day is recommended. Add fruits and other natural sources of fiber to your diet. Laxatives and stool softeners may be recommended. Discuss the best options for you with your healthcare team. Fiber supplements are not generally recommended for constipation. They may make the symptoms worse. Probiotic supplements or foods containing probiotics, these are natural bacteria in your gut, may improve constipation. Suppositories and enemas are not recommended if you have a low white blood cell count, otherwise known as neutropenia, or have low platelets, known as thrombocytopenia. This is due to the risk of infection or bleeding. Meeting with the dietitian may be helpful in finding a diet that works best for you. Don't let more than 3 days go by without a normal bowel movement. Discuss this with your healthcare team. Let your doctor know if you have pain with bowel movements, any blood in the stool, severe abdominal pain, persistent nausea, or vomiting. Now let's talk about diarrhea. Stay hydrated. Again, drink 2 to 3 liters of fluid per day. Liquids with electrolytes may be recommended. Avoid high-sugar sports drinks or fruit juices. These often make the diarrhea worse. Anti-diarrhea medications may be recommended. Discuss which medications are right for you with your healthcare team. Be sure to ask how many of these medications are safe to take each day. Meeting with the dietitian may be helpful in finding a diet that works best for you. Report any blood in the stool, severe abdominal cramping, fevers, or symptoms of severe diarrhea to your healthcare team immediately. Eat small, frequent meals. We often recommend the BRAT diet. This includes bananas, rice, applesauce, and toast. Foods to avoid: dietary fiber, things like brown rice, fruits, vegetables, popcorn, and whole grain breads or pasta, alcohol, caffeine, chocolate, or greasy foods, and dairy products containing lactose for some patients. Increase the intake of foods and fluids high in sodium and potassium, such as broths, soups, low-sugar sports drinks, potatoes, and crackers. Probiotic supplements